primary care network is a clinical network of physicians and other providers in a geographic area working together in new ways to expand team-based supports for family doctors and patients.
So to me, a primary care network is a system in which the primary care needs of a patient are not given piecemeal. They're given in collaboration with other allied health providers as well as other physicians, but are done in a team-oriented way.
So primary care networks to me means being able to complement my patient care. I can do all of my hands-on, I can do my investigations in working up a patient's medical problem, but then I need to be able to take that to the next level. And often that requires complementary access to supportive care in the community, networking with teams that I need to be able to complement my work.
Primary care networks is also, I think, what we've all strived to provide all along. It is a more formal structure, and for the first time in a long time, I feel as a GP that I now have availability for my patients to get the care that they need without such a struggle.
When I think about primary care networks, the step before that I think a lot about is divisions of family practice. If I think back to when I joined the board of the division, one of the things I wanted to be able to say is that people know what the division is without you having to explain it. The one-sentence version of the division to me is all of the family doctors within the community working together for common purpose to provide primary care for the community. If you look at that and you take it one step further, the primary care network starts to include everyone who's involved in primary care in the community.
Because as a family physician, you just can't do it all. You're the quarterback. And the quarterback cannot play the game without the rest of the team there for him.
The practice has changed a lot. I remember when I first practiced in a family medicine clinic in Burnaby, a patient would come in with a pile of paperwork from discharge. And I had no idea a patient even stayed in the hospital. And now I'm just getting so many documents when patients go into emerge. And if someone gets admitted, I get even more paperwork. But to me, it's actually a good thing. When someone goes into the hospital, I want to know it because I'm the contact point for a patient and patient's family. Primary care network has implemented a lot of services to make our job much easier. I have patients who's a single mom, no financial resource, came in and crying and asking for help. And with the social worker services, that's one thing I noticed that has changed a lot because now I can reassure a patient that I can connect her with someone who knows where the resources are and they feel reassured. And the most recent change is the counseling. Even just past week, I have a young teenager that used to have a counselor, but the counselor left. And also she couldn't afford to find a new one. I refer her to the counseling services that's created by the PCN. And patient was happy come back a week later telling me that the counselor really helping her.